Hello, everyone. Thanks for giving me this opportunity to present our experience and evolution of practice in tonsillectomy based on over 1,500 cases. My name is Mohammed Shaker. I used to be a senior clinical fellow in Sheffield Children's Hospital. A brief introduction: tonsillectomy is one of the most common ENT procedures, and techniques have changed remarkably over time. Our practice has also changed as a result of evidence obtained through over 1,500 tonsillectomies performed over 3 years, 2017, 2018, and 2019, in a tertiary pediatric institution, Sheffield Children's Hospital. In our institution, tonsillectomy is usually performed either by bipolar extracapsular tonsillectomy or extracapsular coblation tonsillectomy or intracapsular coblation tonsillectomy. In our cohort, there was 1,576 cases. Most of the cases were performed by intracapsular coblation tonsillectomy in 752 cases, representing 47.7% or almost half of the cases in the 3 years, followed by bipolar dissection tonsillectomy in 543 cases, and finally extracapsular coblation in 281 cases. This graph shows our evolution of practice from 22% of the cases performed by intracapsular coblation in 2017 up to 70% of the cases in 2019 were performed using intracapsular coblation tonsillectomy. At the same time, bipolar dissection has declined from 39% into 27% in 2019. Also, extracapsular coblation tonsillectomy declined from 39% in 2017 to 3% in 2019. In the cohort, the mean indication of tonsillectomy was sleep disordered breathing or obstructive sleep apnea in almost 1,200 cases, representing 75.8% of the cases, followed by recurrent tonsillitis in 545 cases, around 34.5%, and in 10.3% of the tonsillectomies, it was performed for both reasons, sleep disordered breathing and recurrent tonsillitis. Finally, asymmetric tonsils or suspicious of malignancy represented 10 cases or 0.9% of the tonsillectomies in our cohort. The overall complication rate dropped from 10% in 2017 and 2018 to just 4% in 2019. Post-tonsillectomy bleeding dropped from 39 cases in 2017 to 19 cases in 2019. There was a spike of pain or readmission into the hospital for pain in 2018 with 16 cases. We can see in this chart the rate of bleeding per technique. So you can see that in bipolar dissection, around 7% of the cases developed post-tonsillectomy bleeding in the 3 years, 2017, 18, and 19. The rate of bleeding after intracapsular coblation tonsillectomies was around 1.4 to 1.8%. And there was a huge variation in extracapsular coblation from 9.7% in 2017 to 15% in 2018, and no cases in 2019. This is because the decline of popularity in extracapsular coblation, as not much cases were performed using this technique in 2019. The 10 to theaters was 1.4% in 2017 and less than 1% in 2018 and 2019. This represents around less than 1% in the last 2 years. As a conclusion, there was no statistical difference in the rate of post-tonsillectomy bleeding between different grades of surgeons. Intracapsular coblation has become the standard technique for tonsillectomy used for cases or done for cases with sleep disorder breathing at our institution, gaining popularity over extracapsular coblation tonsillectomy and bipolar dissection tonsillectomy. Thank you, and any question?